Transversus abdominis is a muscle that is commonly used in managing back pain and impairments nowadays. Transversus abdominis is a muscle that's been in the research literature as a respiratory muscle for many, many years. But since the early 1990s, it's now become a stabiliser of the lumbar spine. And it has good evidence to show that it has a significant role in having a stabilisation role in function, in movement function for the lumbar spine. The retraining of transversus abdominis, though, has been open to a lot of debate. Many people have come up with a whole variety of different exercises to retrain transversus abdominis. The first research showing that transversus abdominis was linked and changes in transversus abdominis feed-forward timing were linked to back pain were published in the early 1990s, 91, 92, 93. The first papers on any RCT that showed in a clinical RCT that the transversus timing delay could be improved with a retraining exercise was published in 2007. So consequently, there were 15 years of people coming up with good ideas based on theoretical frameworks of how to retrain transversus abdominis. But the papers published in 2007 by Henry Sarr and Paul Hodges showed that cognitive hollowing strategies, using imaging ultrasound to check that there was a corset effect being developed, was an effective way to start to improve or start to correct the timing delays in the feed-forward process that's related to pain. They also did a series of studies showing that functional movements, low threshold core stability exercises a la Pilates, some of the higher loading core strengthening exercises commonly used in gym programs do not change the timing delay in transversus abdominis in the short term. Now, it's very clear that functional movement training, low threshold core stability training and high load core strength training have definite advantages for performance and function in the movement system, but not for changing the only measured pain-related deficiency in transversus abdominis. The only pain-related change in transversus abdominis is the timing delay. And so we now have evidence that shows that the best practice will be to activate the transversus hollowing strategy, pulling in the lower abdominal wall without moving, with the trunk supported in lying, the trunk supported in sitting, the trunk supported in standing. But movement-based training, where we do functional movements or non-fatiguing core stability exercises or fatiguing core strength exercises, do not change the timing delay in the short term. So is there an advantage of activating your transversus and holding transversus active while you walk along the street, while you do a mat work class in a gym, while you do some resistance training in the gym? It appears that there might be benefits from doing that, but not for transversus abdominis. When we do movement, we become global oblique dominant. And there are definite advantages from the oblique abdominals helping you control rotation, but they will not, in the short term, change the timing delays in transversus abdominis. The way to change the timing delay in transversus abdominis is use a cognitive activation strategy that's non-functional, drawing in or hollowing the lower abdominal wall. Maintain that activation while you breathe and don't brace, and then don't move, but with the trunk supported. So make it transversus dominant, not movement dominant.